at it that it's kind of like some progress is kind of better than none, and we're gonna make a lot of mistakes, and it's gonna be kind of 2 steps forward, 1 step back. And I think that's the approach we need to take, because otherwise we would just kind of stay stagnant.
Okay, I'd like to ask if anyone has a question from the audience. Yeah. Go right ahead.
I was wondering if this security thing is really a false fear that's being put out to reduce transparency for the consumer and to keep out the disruptive companies like Microsoft and Google. And then the second part of that question to doctors, do they have that fear as well that all the medical records?
Yeah, well, I'll certainly, as an organization that's certainly trying to disrupt.
Wait, just a
so
second.
the
Did
question,
everyone hear that question?
Yeah, repeat the question.
Okay, I'm going to repeat the question. First, the first part of the question, as I understand it, is the privacy security kind of bugaboo being put out there by others to try and keep the transparency down and basically close off from disruptors like Microsoft or Google from entering the market. And the second part of your question was? Are doctors also colluding on this? Or will they collude on this to kind of keep control of the data and keep it from being released and allowing mobility on the part of the consumer to choose what providers they wish?
Yeah, I mean, I'll just leap in. I mean, I think whenever I'm listening to somebody in healthcare tell me why something can't happen, that in fact is happening in every other industry in the world, I'm trying to separate reasons from excuses. And very often security is thrown up as an excuse, not a reason. And you can guarantee the most strident people using an excuse are the ones who've got something to protect, and it's what my daddy's called the 3 Bs: bullshit baffles brains. Basically, it's sort of they're trying to distract attention. So yeah, I think there's a lot of that. People are, and we're dealing with a lot of health plans, for instance, from which we're getting data, and there's a huge range from people that see connectivity as a business differentiator and they want to go and lead that way, and others are trying. You will pry my data from my cold, frozen hand on the other end of the spectrum. So that yes, healthcare is addicted to its own inefficiency, and a lot of people are trying to protect the current, reimbursement model in order that, and including some doctors. But having said that, there are plenty. It's a bimodal distribution. There's plenty of doctors and institutions that are happy to get connected because they see that's the right thing to do, and ultimately they'll deliver better care and deliver more value. And we need to figure out the right people to work with.
I think the fear factor on the consumer side, I think first of all you have to measure the fear factor of the industry and separate that then if you actually went and talked to 1 million consumers.
Right.
Because they're very, very different. So I think sometimes the industry is kind of really kind of leading hard with that. On your second piece, I can understand some of the physician concerns. So think of a situation where somebody is seeing 5 or 6 different physicians and data starts freely moving around. What we're finding out is that physician 1 is concerned that if they get all of the data from physicians 2, 3, 4, and 5, that now the 10 minutes that they're able to spend with that patient just became negative 15 because they feel like they have to go through everything or they're liable. So we've got to be very smart about that. Doctor 1, 2, 3, 4, and 5 maybe only need to see 6 or 7 points and pieces of information. So we've got to get all the way down and detailed about what data needs to pass to make it usable, consumable by the physician to do what they need to do, and not just say, here is a 20-page chart that we just dump to you electronically, because they have a real fear of that they'd be liable if they don't go through all 20 pages. And it's a real one.
Yeah, I would say, going back to that Massachusetts example, that we had 96% of the individuals. As David said, we separated out from the vendors versus the individuals. We had 96% opt-in, so it was a great opportunity for us to show that, once explained what the benefits are, that happens. On the second part of it, I would actually put up another statement about the fact that are doctors fearing that people are going to shift around. I'm going to say basically we don't have enough doctors to handle the workload that's out there today. Any doctor who's worried about losing a patient is not potentially is probably not a good doctor to begin with, because in essence today, when Massachusetts went to universal health care, physician coverage, our individuals per physician went from 1 in 2,400, that's one doctor to 2,400 patients, to 1 in 4,000. So in essence, when you give, an incidental activity of giving everybody health care is that they want to go see a doctor. And so we are significantly facing a physician shortage coming today. So the second factor, if a doctor is fearful of that, is not really aware of their situation and what's going on with the medical community today, and the fact that it's almost impossible for individuals to move doctors today from that standpoint of trying to find another doctor who can actually take care of you with a panel.
Okay, I think we're getting kind of time for me to wrap it up. I'd like to make one point here as we close, putting on my analyst hat, and that when I read the description of this particular session, it starts with demand for electronic personal health records and online health services will take off when consumers trust that their personal information will remain secure. I don't really buy into that. My belief is that when consumers feel that they can get value from having their information out there in some sort of repository like a Health Vault or working with KP, where they can access it, make their appointments online, do their prescription refills, what have you, get immunization records for their kids' summer camps. When you start getting value from it, then and only then will you see mass adoption. And I think what we haven't really figured out yet is what is the value proposition, because it's a very fragmented market and every individual has a unique health situation and how they want to manage their health or the health of a loved one. So I think that's the challenge that technologists need to really look at, is how do I create value for a large enough part of the market to make a business of it. And I think once we get that squared away, these other issues will become irrelevant for the most part. With that, I'd like to thank the panelists. They did a great job, and thank you, audience.